All right, so we're gonna go ahead and do something different from last time, as I had said. Last time we went more over critical thinking as we went through the questions. I picked 3 questions that we went over in class on, I believe it was Friday, that were the decision tree. So let's go ahead and do those just as practice. And let's just jump right in. So we'll start with number 1. And number 1, the question is, the charge nurse knows that which assignment would be appropriate for the RN. So we know by reading the question, if we look at that sheet that I sent you, as well as the decision tree in general, that this is a scope of practice question. And when we have a scope of practice question, we use steps 1 and 5 of the decision tree. Steps 1 being identifying the topic. So if we identify the topic of this question, it is scope of practice. Who is able to legally, within their scope of practice, care for this patient? And in this case, it's the RN. Okay, so there's our topic. Then we go to our 5th step, which is what is going to be the best outcome, of course, having to do with safety. All right, so let's start with number 1. So would it be most appropriate for the RN to take care of a 56-year-old woman with emphysema scheduled to be discharged today or later today? In this question, it's not mentioning anything as far as, trouble breathing or anything having to do, they are basically kind of trying to throw you off, because we do know that when we do discharge, we teach, right? So keeping in mind that if you were to pick up a Kaplan book or take a Kaplan class right now, that you would actually, it would be different. They would have LVNs, because in the RN world here in our NCLEX, it's, RNs only take, or I'm sorry, LVNs only take the, the stable patients, and they don't do the teaching. And we know that's not true. So since you're not in class and you haven't heard me say it 500 times, just making that differentiation, that we definitely know that it's in our scope of practice, but for the test of NCLEX in the RN world, the RN is, like I said, I think before, it really is like the top notch. They do the teaching. LVNs take, unchanged, very stable. It's a different viewpoint, if you will. So I just want to make sure to say that again. That's why some of the time, maybe if you look at a question and a rationale and you're like, okay, that doesn't make any sense, even though you're not comparing it to your work, that's why. So with this patient, this one kind of sticks out to me already because it says scheduled for discharge later today. I know teaching is going to be involved, and who is going to be doing the teaching, even though I know an LVN can do it. That's not the game here. It's RN. So I'm already kind of leaning towards this, but I've got 3 more potential answers. So we don't want to skip those. Number 2, a 41-year-old woman in traction with a fractured femur. Okay, there's nothing in this answer that indicates that this patient is not stable and that an LVN is not able to care for this patient. And if we had to go between number 1 and number 2, which one is going to be the most, scope of practice wise for the RN? It's going to be number 1. So number 1 is going to trump number 2. So I'm going to eliminate number 2. Number 3, a 34-year-old woman with low back pain diagnosed, or sorry, my dogs are barking outside. A 34-year-old woman with low back pain scheduled for an MRI. Yes, an MRI does have teaching involved. And this is why I like this question and why I picked it, because it's going to come down to where questions are similar and there might be teaching on 2 different things, but which one's most important? If someone's being discharged versus someone getting an MRI, not that I don't want my patient to be informed, it's going to be more important that I'm going to talk to that patient who's going to be discharged. Because of course, before someone gets an MRI, they fill all the forms, do you have metal in your body, this, that, the other. It's more about patient teaching. So yes, if number 1 wasn't there, I would pick number 3, but number 1 is there. And that's more important. Emphysema and discharge today. I want to make sure that is completely locked in and the patient is completely aware of everything to expect and understand. So I feel comfortable at this point getting rid of number 2 and number 3 because number 1 is the best answer thus far for the RN being the most appropriate to care for this patient. And then we come to number 4, a newly diagnosed 43-year-old, newly diagnosed with type 1 diabetes. Same thing. I would want to care for that patient as the RN because this patient is newly diagnosed with diabetes. But if I had to pick one or the other in this moment, it's going to be number 1. So the actual credited answer would be number 1. Okay, and again, I said this last time, we're not always going to like what our answers are. We're not always going to love them. But one thing that we talked about in class that I mentioned is this patient going to be here? Yes, this patient's going home. So it'd be the most appropriate for me to have this patient right now because this patient's leaving. This patient is not. Sorry, my dog's choking. Come here. Come here. You're fine. They're fine until I do videos or Skype or whatever this is, Zoom, and then they choke and throw up and yeah. Anyhow, so that's another kind of thing to look at. And I choose specific questions on purpose, especially for class and for you that are kind of weird so that I can kind of show you, hopefully it's making sense because obviously we're not like together. But why? So this person's leaving, this person is not. So it's most appropriate for me to get to this woman. And yeah, maybe the question's not saying who would you see first, but I know this lady ain't going nowhere unless something weird happens, but we're not making up stories, right? Okay, number 2, a woman is admitted to the hospital with a ruptured ectopic pregnancy. A laparotomy is scheduled. Preoperatively, which of the following goals is most important for the RN to include in a client's plan of care? Okay, so we see that word most, we know it's priority. We're going to use all 5 steps of the decision tree, starting with the first one, which is, I'm going to say ruptured ectopic pregnancy, preoperative prep. That's my topic. Then we're going to go down to the second step, which is implementation versus assessment. Number 1, fluid replacement is implementation. Number 2, pain relief is implementation. Number 3, emotional support, that is implementation. And number 4 is respiratory therapy, that's implementation, therapy is implementation. So we're going to keep all 4. Unfortunately, we can't get rid of any. Then we're going to go down to number 3, which is Maslow's, which is physical versus psychosocial. Number 1 is fluid replacement. That's physical. 2 is pain relief. Now remember, it is if it's life-threatening or limb-threatening, it's physical. So for example, in this case, if you don't know, just keep it. Don't take that chance of getting rid of it. Hopefully by the time you get to number 5, which is best outcome, you would catch it, but just keep it. Keep it. And in this actual case, it's physical because it's a ruptured ectopic pregnancy, which I'll get more to. So I would actually keep it. So if you don't know, just keep it. It's not going to hurt. So we're going to keep number 1 and number 2. Number 3, emotional support, although that's extremely important. In the Kaplan world, it's just not, which helps us, right? Because we get to get rid of answers. Emotional support, what is that? Psychosocial, boom, gone. It's done. So I'm left now with number 1, 2, and let's see with number 4, respiratory therapy, definitely physical. So I'm left with number 1, number 2, and number 4. Okay, and then we go down to our ABCs. Number 4, fluid replacement, that is circulation. I don't know if we've said this. I don't think, no, because the first time I'm doing this with you, if we give 10 cc's just like a flush, that is not fluid replacement. And if you watch the videos, it talked about that a little bit too, but I want to just keep in mind because it can seem a little confusing. Or if you take a drink of water, think of fluid volume. You're actually putting in more volume into the body, not just like a little boop. You're actually, or I'm going to give, Lasix through the IV or whatever. So this is actual fluid replacement. That is circulation. Number 2, pain relief is ABCs. No. So we're going to actually get rid of it. Number 3, we've already gotten rid of. And number 4 is AB, airway breathing. So now we're left with number 1 and number 3. I'm sorry, number 1 and number 4. So we're going to go down to our 5th step of the decision tree, which is what is the best outcome for my patient in regards to the topic? And that's why the topic is so important, because if we don't have that topic, we don't know what the question's asking us. So what I like to do is 2 things: go back to the topic and I reread the question at the end. I find that to be very helpful because we've already read all this stuff, we've done all these things, and we want to be accurate, right? This is very important. So I know, okay, well, and remember what I know about this. Okay, a woman is having a ruptured ectopic pregnancy. I know that's dangerous. Ectopic pregnancy is where we're having a pregnancy not in the uterus, but in the fallopian tube. And now that has ruptured, that can be dangerous. That can lead to bleeding. A laparotomy is happening. A laparotomy is basically exploratory surgery of the abdominal area. Okay, preoperatively, which of the following goals is most important for the RN to include in actually taking care of this patient? So I am in anywhere in here, does it say that she's having trouble breathing? No, it says nowhere in here that she's having trouble breathing. I'm not saying that they may not put a little bit of oxygen on. I have no idea, but it doesn't say it. But it does say ruptured ectopic pregnancy. And I know with a ruptured ectopic pregnancy, you're going to be losing fluid and you can be losing it very quickly. So between number 1 and number 4, if I had to pick an answer, we're going to do both. I mean, let's just be real. But what is the question asking you? What is the topic? And what do we need to do right now? We need to give fluid replacement. And that is why that one is the right answer. So that's something that I taught also in class. And again, why I'm choosing specific questions is that a lot of the time, people say it's always A, B, then C. And then I've heard now it's going backwards. It's C, B, A, and this and that. You know what? No. It depends on what the question is asking you. And this is the example I always give. Let's say you had a patient, and I always use this, but I always kind of fumble over because it comes from memory. So, okay, you have a patient, 65-year-old patient, and you are a home care nurse. You come to check on your patient and she is having a dependent edema and is complaining of pain in her right lower extremity. Pulses are normal, blah, 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 blah. Patient's fine. It's the edema that's hurting. Okay, what would you do? A, insert an oral airway. That comes because we know this is a circulation question, right? It says nothing about her having trouble breathing, but A comes before C, right? That would make no sense. So my whole point of saying all of this is it's not always A, B first. It depends what the question's asking you. So would you insert an oral airway first? Would you start giving her CPR, or would you elevate legs and give prescribed Lasix? It would be C, which is actually circulation, over the other 2, which are airway breathing, right? So keeping that in mind, I find that very helpful. Maybe that's just me. And if I can give 1 gem here, 1 gem there, that 1 gem might be that 1 question that helped you pass your test. Okay, last one with the decision tree. The RN is caring for a client who underwent abdominal surgery 6 hours ago. Which of the following actions by the nurse is most important? Okay, we see that word most again. And that means it's a priority question. We're going to use all 5 steps of the decision tree, starting with step 1, which is identifying the topic. Our topic, remember, we always look at the time. 6 hours ago versus 1 hour ago versus 12 hours ago versus a week ago. All of that can matter. So we know that somebody had abdominal surgery recently, 6 hours, right? And what is the most important thing that we're going to do for them with this procedure in this amount of time? Okay, let's see. So we're going to do now the second step, which is implementation versus assessment. Number 1, have the client use a pillow to splint the incision. That's implementation. Number 2, instruct the client how to safely get out of bed. That's implementation. Number 3, reinforce the dry dressing to provide more padding. That is implementation. And number 4, turn the client to check for bleeding underneath her. That's implementation. Unfortunately, we can't get rid of anything at this time. So then we're going to go down to Maslow's, which is physical versus psychosocial. If we look at all of these, none of these are psychosocial. And once you kind of, I think I said this last time, once you, and I'm not saying skip steps, but I just read them. I know that none of these are psychosocial. I can just whoop. But if you don't feel comfortable doing that, don't do that. So none of these are psychosocial or any ABCs. Okay, let's have a look. Have the client use a pillow to splint the incision. Is that airway, breathing, or circulation? No. Number 2, instruct the client how to safely get out of bed. Is that airway, breathing, or circulation? Now that can be fought, if you will. I'm going to keep it because it could be said circulation because it could be orthostatic hypotension. So I'm just going to keep it because I don't know. So I'm just going to keep it. I'm pretending. I just don't know. I'm going to keep it. Number 3, reinforce the dry dressing to provide more padding. Is that airway, breathing, or circulation? No. And the reason it's not, some people will say, well, yes, it is. You're checking the dressing and the dressing could be bleeding, but how does it say that they're hemorrhaging? They're not hemorrhaging. It's going to be probably some sort of serosanguis and bloody, maybe what would be the right word? Gob, if you will, like a small amount, but no. So I can get rid of that one. So at this point, I've gotten rid of number 1 and I've gotten rid of number 3. So I'm going to go to number 4, which is turn the client to check for bleeding underneath her. Bleeding. Yes, I know it doesn't say hemorrhaging, but it says bleeding. To me, circulation. And even if you want to keep number 3, fine, we can keep it. And if we wanted to, but I feel comfortable getting rid of it. But we will keep number 2. So at this point, we've kept number 2 and we've kept number 4. So now it's going to come down to step number 5, which is what is going to be the best outcome for my patient? What do? I go back, I look at the question, I look at the topic. So the RN is caring for a client who underwent abdominal surgery 6 hours ago, which was pretty recent. Which of the following actions by the nurse is most important? Okay, we already know that we want to check on this client. Because they said abdominal surgery, what do I know about abdominal surgery? When someone has abdominal surgery, do you think that they're probably laying on their stomach? Probably not, because it hurts, right? So they're probably going to be laying on their back. This has been 6 hours. And do you really think they're going to be getting out of bed at this point? They're probably going to have a catheter still in, I would assume, unless there's some reason why they wouldn't. But that's a normal procedure to have a catheter in. They're going to be still groggy. That's why we keep the catheter in, so that we don't have the patient get up right away. They're going to have the compression stockings, all of that on. So again, that's why time is important. So instruct the client how to safely get out of bed. Probably wouldn't do that yet, but I don't know. I don't know the procedures of the hospital or the policies, but if I had to choose between number 2 and number 4, and a lot of people actually they actually like number 1, but do you see how when we use the decision tree, we got rid of it? And it makes sense, because if you actually think about what the patient's doing and how they're laying, turn the client to check for bleeding underneath her, because the blood can pool, because the patient is laying on their back because they had abdominal surgery. This is a hard question. So and again, these are all passing questions. These are all kind of trick questions. And that's why I'm going through them with you. So hopefully that was helpful. If you feel totally frustrated and like, oh my God, remember, not every question is going to be like this on the NCLEX. Maybe you're like, oh my God, this was so easy. I can't see your face. However, let's say you went through this one, you're like, oh, I hate this question. I don't know. You know what? You do your best and you move on, you forget about it, because you're going to get the next 2 right. And then the more you stress, unfortunately, the more anxious you get, and then what happens, and you miss questions. So I hope that was helpful. Doing the decision tree. I'm going to go ahead and stop sharing this and download it and send it on over to you. Happy 4th of July. Please be safe. If you can try not to drive tonight. A lot of people on the road doing things that are not safe. And I will be in touch. Thanks so much.